So, Dr. Bilski, here's a question for you. I know there's dental, there's pediatric children's dental, basic specialty. Mm-hmm. What is the cutoff date? How old is too old to be going? Could I be sitting in a chair right now like this, going, what do you think, Doc?
It's pretty funny. Of course, I don't want to say the name, but I have a few friends that are in their 50s now. This one particular person I've known for a long time went to a pediatric dentist until she was 18 years old. Now, there's nothing wrong with that. But the funny part is pediatric chairs are smaller than the ones that you come into my office.
She must have been petite.
So she's okay. Yeah, she was. And she just loved this guy and loved the hygienist.
Yeah.
And she had, a few cavities maybe filled here and there. And the pediatric dentist at this time, since retired, he's an older gentleman, was literally like 5'5". And this gal is 5'7". So
do you have a box or something to stand on or what?
He had been taking care of her since she was 4 years old.
Yeah.
So he said, I don't want to use the name again, but it's been 14 wonderful years working with you, looking up at her. You were 18 years old. You were going to college. I would like you to start to see whoever he recommended at that time. So, but there are patients that do that, and there's nothing wrong with it. Some pediatric dentists actually take care of geriatric patients that may be beginning some dementia. And they can see him in the hospital.
Yeah,
so that's
sure.
I mean, not everyone does that, but the question is, how old is too old?
Well, let me ask you: is it how old or how tall? From what you said, it's basically how tall you get.
So
how big you get.
One of my good buddies, Dr. Kevin Wright, he's out in Fort Wayne, Indiana. He's 6'2".
Oh,
and he's big hands. He's a big guy. He's been taking care of little kids forever. So it doesn't really matter. It's the demeanor of the doc that takes care of the kids. And how the kids should be managed. We don't want to frighten anybody.
Yeah.
Typically, we started seeing our referral patients that went to the pediatric dentist coming back to us about 12 to 14 years old.
Yeah.
Usually after they finish orthodontic care. So if they started at 12, they might be done at 14, 15, or they just come on over. So it doesn't matter. It's really what the young child needs and what the parents feel comfortable having taken care of, or whoever.
And maybe there just might be some point where, 14, 15-year-old kid, again, I'm not going to go to the kid's dentist anymore,
That happens.
Who knows?
That can happen when they're 7 years old. Like, this is for babies. Because maybe that kid was in there. It's usually a boy who's
do you guys have high chairs at your place just in case you get a young coming in who's blowing off his pediatric guy?
Nope. You're going to be a big boy. You're going to be a big girl. Okay, this is what we do. Keep your hands on your belly.
That's
Keep
it.
your mouth open.
Great.
Something bothers you, raise your left hand.
That's it, huh?
And we take care of them, and they know that there's a toy box that they pick one toy.
That's the important thing. Let's be honest.
So risk reward. Like, I'm going to risk my life in this dental chair with this guy over the top of me, and then I'm going to get a toy.
Yeah.
I'm 7. I could do that.